Welcome back to another episode of Thanks for the Consult. As always, I'm Fior. We have Aaron with us. There's Aaron. And this week we have Andrea Law. You may know her from TikTok as Nurse Andrea Law. Um, welcome to the show. How are you?
Hello, I'm fantastic. Thank you for having me on the show.
We're happy to have you.
Thank you.
I can say I originally found you on TikTok. Some of your, kind of pro EMS content really struck me. Um, and it kind of we wanted to get to know some more nurses on the show and kind of get your perspective of us and so on and so forth. But before we dive into that, tell us about yourself. Um,
So,
yeah.
yeah, definitely. So, I am Nurse Andrea Law. Been a nurse for about 10 years. It was my second career. I worked in business before that. Loved it, did really well. Left as the chief operations officer of the Better Business Bureau. So, kind of got that back end business experience under my belt, but wanted to help people in a different way. Um,
Yeah.
so moved into, but also ironically, um, it's hard to really move up in business without like having an MBA or a lot of experience. So I'm like, okay, oh my gosh, that's so much school. I don't really want to do that much school. Let's go into nursing. As I finished my bachelor or my master's a couple years ago, looking to go on to my DNP soon. So
Okay.
school, I feel like just, is in every degree field, learning constantly is really important. So after moving into nursing, was kind of drawn immediately to home health for a lot of different reasons. At the time that I was getting into nursing, I did my preceptorship in the ED, which I absolutely loved, and I had the most amazing experience. I had the best preceptor imaginable. Such a great experience, especially compared to my compatriots in the same class. And I really, really wanted to do that. But with kind of what was going on in my personal life, I figured that was probably not going to be an option at that time and really needed the flexibility, stability, and the pay really that home health offered because I
Yeah.
anticipated accurately that I would need to be a primary breadwinner shortly thereafter. So got into home health after that and just absolutely loved it. I get so bored if I'm in the same environment day after day, and I just don't know how people do it in any
Yeah.
kind of facility, whether it's a hospital. And granted, the experience you have with your patients is different, but just I feel like I would be cooped up in that type of environment. And it's important to recognize as an individual where you would flourish. And for me, I absolutely have loved community health, working with patients directly in their own natural habitat, kind of getting to know them. And much to my own surprise, really kind of had an affinity for wound care and ostomy care, which is kind of somewhat like like if home health wasn't already the redheaded stepchild of the nursing field, right? Let's add wound care and ostomy care. We're
Have
talking
a
maggots and poop.
tremendous amount of respect for those that specifically that line of nursing, because I had diverticulitis that I ignored for like 2 weeks
Oh,
until it ruptured.
mm,
It's like a whole long drawn out thing. I was ended up being in and out of the hospital for over a year, had home health
oh
nurses,
my gosh.
but
Wow.
it takes a very special person to, deal with like the wound vacs, because it hurts. And like I'm sure they cuss at you and call you all kinds of nasty names, but you're doing what you have to do to help. And then changing those ostomies, because people, especially when it's new, don't want to accept that it exists on their body. And so
So
You
I,
must have been a
true.
hero. Like with the people you work with, they were like,
oh
"Yes,
yeah,
we love her. She's doing all that."
I found so much fulfillment. It's funny that you say that because there's so much body dysmorphia with having that change in your body. And it's so hard to accept. You kind of go through the stages of grief and loss when that happens, and it's important to help them through each of those steps. So, really, more what we're doing is helping them with that versus actually physically showing them how to manage the appliance. And so, I have had multiple patients who literally thought my life is over. Like, what kind of life am I going to have with this? You know? And some of them even contemplated ending their life. And so to take them from that really deep, dark place to showing them that there is hope and there is a life and that it can be a good, happy, healthy life, with the tools that we have, with the knowledge that we have, is so rewarding to see them. And I keep in touch with so many of my patients that I had over a long period of time, and they'll send me pictures. One guy, he was like the happiest bachelor traveling the world, making just tons of money in like the oil industry, and suddenly he had a cancer where he had to have an ileostomy, which of all the ostomies, that's the one you don't want. And so he's like, that's it. My life is over. Like, I can't work. I can't travel. I can't make money. Girls aren't going to like me anymore. And so over maybe 6 months or so, turning his whole life around. And now he's back working. So he will text me every other month or so and be like, I'm in Thailand, I'm here, I'm there. Or he'll, get me a little souvenirs from different places. And he's like, oh, I'm in Mexico. And I just love that. It's like really life changing for them, but also for me. So it's funny that you
Yeah.
said that.
No, yeah, it's it's crazy. And you are 100% right. The ileostomy is way worse than the colostomy. I believe I'm uniquely qualified to speak on that because I had both obviously at different times. But
Yeah,
luckily for me, mine was reversible. But it was, like I said, it was over a year, closer to 2 when it was all said and done, from the day I went into the hospital to the day I was like eating food again at the end of it. So,
wow.
but yeah, no, huge bit of respect for the nurses that handle that. So, because it's awful. And you're right, like, because I was young and younger, I guess, and single at the time, and it's a it's a lot to process. But
Absolutely.
so yeah, I definitely get it. You do some awesome stuff there for sure. So
Thank you. I
yeah,
appreciate that. I love it.
yeah,
Absolutely love it. So that's kind of how I moved in from business over to nursing. And
okay,
initially, when I graduated high school, I actually wanted to be a psychiatrist, which was funny because my first degree in college
okay,
was in psychology, ironically. Then,
okay,
sometimes you just figure out what you want to do late in life, and that's okay. Like, you're
yeah,
never too old to change career path. I think in nursing school, the oldest graduate was like in their 70s.
wow, yeah.
So,
I've been having quarter life crises recently, trying to figure out what I want to be when I grow up.
quarter life crisis. I've never heard that. That's hilarious.
Yeah,
Yeah,
that's what's going on over here.
that is.
That's okay. You'll have another half 50% midlife crisis and then a 75%. That's okay.
Yeah,
Yeah,
It
yeah,
changes. What you want and what you find rewarding will change as you grow and evolve, and there's nothing wrong with that.
it's not
absolutely.
about the crisis; it's about the journey.
Isn't the
Exactly.
crisis the journey though?
Listen, I would have studied if I knew there was a quiz.
That's a good, okay, I'm taking notes. Taking notes.
um, that's that's interesting take you have there, Aaron. But
Thanks, buddy.
yeah, anytime. So with working with the home health, I guess obviously you run into people like us a bit, having to call us when presumably sepsis is probably a big issue that you run into a lot. Because I know from what we do, most people, I don't know how they could live in the conditions that their homes are in. They're dirty and like uncomfortable, but on top of that, to have open wounds and things like that healing. I'm sure sepsis runs pretty rampant. But
Definitely.
yeah, so I'm gonna ask a hard question for probably a lot of our listeners to hear the answer to. But how can we be better for you guys?
That's really a tough question because honestly, in my experience, I've overwhelmingly had positive experiences with EMS. I probably
Okay.
only had not even really bad, just that
Okay.
like there could be some constructive feedback there, but like who am I to give it? We all have like bad days. And one of them honestly was like it's kind of funny now reflecting back because it was in COVID.
Okay.
And the patient, I'm trying to remember exactly, was like actively having a stroke. And the patient was
Okay.
agreeable to go to the hospital, call the EMS. The guy shows up, and you kind of, some people you could just kind of catch a vibe off him. He's wearing like, big guy, looks like he was a Marine or something, has the vest, how he carries himself, how his voice is. You're like, I'm just gonna get to the point and get out of this guy's way. Like, so, I give the handoff. He starts talking to the patient. And at that point, the patient's like kind of wishy-washy, like he kind of doesn't want to go. He's like kind of getting sassy. And like the paramedic, I can't remember exactly what he said, but he was like, it was very pointed. Essentially, make up your mind. You're wasting our time. Do you want to go, yes or no? Because we could be out actually saving somebody's life. That's the nice way.
And this
So he's
person's
kind
having a
of,
stroke?
yes. And I'm like, I
Wow.
don't even necessarily, I'm not even really mad at him because, like, I wish I could say that. But and
Yeah.
it's funny
Wow.
because everybody in the room, because there's a couple firemen that had showed up, the EMS crew, the patient. And it's just funny how that patient just like turned right back around. Like he was just in his wheelchair, like, yes, I'm gonna go. Like, yes, sir, let's go. Like, so I think some people just kind of need to hear that and they respond better. And especially sometimes we run into people who sometimes that male voice, like they never
Uh,
grew out of the toddler phase where they
yeah.
just need that male voice to be like, look, you have to make the decision. Here's the facts. You are competent and you have capacity. So choose. If the answer is no, we're not going to sit and argue with you because there's people dying out there.
Yeah.
So yes or no, like make up
Luckily,
your
I
mind.
guess for us in Pennsylvania, there's a standard form we have to fill out, right? And it's your
Hmm.
vitals, things like that. But there's certain things that if you tick yes or no on them, it's automatically you have to call and talk to a command physician.
Oh,
Uh,
that's interesting.
yeah. So like, there's often times where it's like they want to refuse, but if they're tachycardic and their heart rate's 101, that's technically tachycardic. And you call and they're like, "Why are you calling me with this?" It's like, because I have to. But there's other stuff though that is good. And I've actually had a doctor, put me on speakerphone. I want to talk to him. Okay, and they'll tell him like, "Hey, listen, you have every right to make a stupid decision, stay at home and die, but that is what you are deciding is to stay at home and die." As long as you
It's
understand
remarkable to
that.
me how many EMS people have like no boundaries whenever it comes to what they're willing to say to someone. Like there's
Oh
some
yeah.
big swingers out here in EMS that are just saying stuff that I'm like, I would never ever imagine saying that to another human. And it works.
Really?
And I'm like, wait, how did you know that? I've heard the other things you
Yeah,
say, and you shouldn't have known that.
so funny.
Yeah,
That's
I
hilarious.
think like everything in life, it's all with how you carry yourself and the delivery of it.
Yeah, definitely. But I mean, I gave the guy a pass in that situation. It was funny because the
Fair
fireman,
enough.
he like apologized for him to me, like, sorry you had to see that kind of apology. And I
Yeah,
was like, no, like here, you guys are in COVID. The guy's probably worked like I don't know how many hours in a row on, actual emergencies where people are wanting help. And here's this guy who wanted to go, he didn't, and now he's wasting everybody's time. Like,
yeah,
I totally get that.
yeah.
But other than that, I've really had great experiences, and I've only really through stumbling into EMS TikTok even realized kind of some of the, I guess you could say stereotypical,
Mhm.
like I didn't even know there was like a nurse, paramedic, EMS, like,
So that's a silly thing. So if you look at like if you were to challenge and get your PHRN and work do the same thing we do, you can do the exact same things we can do, right? So I think a lot of it comes from you guys are able to challenge that test and come out and do what we do, but we don't have a bridge from what we do. And then if we go into the hospital, we are not even, depending on the state, like a CNA basically. And it's like, wait a minute. If I go into the parking lot, I can start IVs, give medications, read a cardiac
right,
monitor, intubate
yeah,
you, give you blood without talking to a single person. I can cut your neck open and stick a tube in your, like,
right.
but if I go into the hospital, it's like you can't do anything. It's like, well, that's weird. So, um, and oftentimes I think from our perspective is,
Hmm.
we get to the hospital and a lot of, there's a lot of great nurses out there. But they tend to kind of forget that like, hey, everything we did was just one person in the back of a box truck rolling down the road, not five or six paramedics and, sitting perfectly still and,
In a
uh,
well-lit,
yeah,
relatively clean environment where there's like surfaces to put stuff on and
yeah.
yeah,
So, I mean, and I think it really genuinely comes from, I don't think either of us fully understand what the other one does.
so true.
But it,
So true.
in many aspects is so similar.
I
But
think if
it,
each
yeah,
individual went and did a shift for the opposite, they would both hate it. Like the EMS people
yeah,
would be like, "Wait, you're telling me I have to be on my feet the entire time? Like I have to like I can't take a nap while I'm working? Are you kidding me?" Like and then like the nurses would be like, "Wait, you don't have anybody else here helping you do this?"
yeah,
Like
right. Well, I think like,
That's
I have to
true.
hope I have cell phone signal to call somebody for help.
Right. That's so true. I feel like I would love it though. I mean, I joke with people. I'm like, I'm the biggest nerd. I feel like it would be the funnest thing for me
yeah,
to travel around the country to all these my friends that I've made on TikTok
yeah,
and like, okay, I'm gonna go on a flight, right
yeah.
along with them, and then I'm gonna go over here for this crew and go over here and just do like a
Hey,
tour. I think that would be so fun.
anytime you want to come to the greater Pittsburgh area, you can ride with me.
If
Uh,
I would have known, I literally would have done that when I was there last month. That would have been a blast. I already know it.
yeah,
Next time, next
yeah.
time.
You'll have to let me know. We have fun. I do a different type of EMS than probably what you're used to seeing. But I
How do you
still
mean?
I do not work on an ambulance. I work on a out of a squad by myself, and
Oh,
yeah, I
I've never
back
even heard of that.
yeah, so I back up other ambulances. So if they don't have a paramedic and they have two EMTs or like an intermediate crew, then I'll provide the ALS to them. If they have an ALS crew and it's like a really bad call, I'll provide additional help and resources to them.
That's
Um,
awesome.
yeah, so it's different, but we get to see crazy stuff. But we also get pulled into some, like why am I here?
Sure. Yeah, because I feel like when people call in,
Yeah,
probably, as a layperson, I'm guessing most of the time they're explaining it to be maybe worse than it is, so they maybe send out more resources than they probably need. So you're like, what am I doing here?
well, you,
What
you
do you need me
start to
for?
learn addresses. You're like, I've been there before, which means they've learned how to get a priority response.
Yeah, I've had a few patients like that. So they're like, oh no, you got to say this or say that or don't
Yeah.
do this or when you even, going into the emergency room, they're like, oh, you got
Uh-huh.
to say this or say, and I'm like,
Yeah.
you're going for wound infection. Why are you saying chest pain?
Yeah.
What?
And one of the guilty pleasures of most paramedics is when somebody calls, you get there and they say something to the effect of like, "Oh, I called 911 so I get seen faster at the ED." It's like I love it when I walk in with that patient and charge is like, "Can they go to triage?" Sure can. Get me a wheelchair.
Oh, and then you get to leave while everybody else hears them, their mouth for the next few hours until they go to the back. Yeah.
I know a
That
Yeah.
guy
would
who
be
used to
pretty
call
rewarding.
triage alerts. He called triage
Oh,
alerts. Like that was like as this is how you know. Please send this person to triage. Like
It's like this is a level one triage coming in.
yeah, and they think that it's like oh man, like he's getting me in high acuity, and he would
top
hype him up too.
priority.
He would hype him up too. He'd be like, listen, I'm gonna tell them everything. I'm gonna let you know that like when we get there, you're gonna be number one priority. It's a number one triage alert. He would
Oh,
call it
wow,
in.
just setting them right up. Oh my gosh, that's crazy. Yeah,
Uh,
so I'm sure you show up at a lot of calls where you probably aren't really necessarily needed.
that's unfortunately part of, daily life in EMS, but
Does that
yeah,
happen to
so
you? Like doing home health stuff? Like, do you ever show up some places and you're like, this person's fine. Like, why did they ask me to go here?
Yes and no. It used to happen a lot more. The way that reimbursement with CMS has changed and kind of motivated hospitals to push out patients with a higher acuity, we're seeing that less and less. And I'm getting to know you guys a lot better because for real legit stuff. I'm like, it didn't used to be where I would be calling 911 like every other week. That was not a thing. In 10 years ago, EMS, like once in 6 months, you might have to call for something. But we do get patients where maybe they're probably community referrals where like the primary just wants somebody to kind of keep eyes on them because maybe they fall a lot or they're, not compliant with their medications and they just want someone to kind of for lack of a better term, kind of babysit them and just provide some education. But again, we're seeing that less and less where now we're going out and it's like, you're a train wreck. You're
Yeah.
you're a whole and a half train wreck. Um, and usually, like when I was a director for a couple of years, and so I'd work with the case managers on the referrals coming out of the hospital. And there was a couple case managers at a couple hospitals that would be infamous for totally downplaying these patients. And, they explain it to be one thing, and it's like Friday night, and they want to discharge this patient because, the doctors don't want to do rounds on the weekend, so they discharge everybody. And that's when we're going to have the least amount of resources, right? Like we don't want to
Yeah.
staff a bunch of nurses on a weekend, so we're kind of more choosy. Um, and so depending on a lot of factors, we'll consider whether we want to take it or not. And, sometimes we'll, okay, fine, we'll take it. I'll go out myself if I can't find somebody, or we'll send somebody. And we're like, absolutely not, based on the wounds they have or infection or the IV, because if they're coming out particularly with a pick, they're on Vanco 3 times a day and maybe on another antibiotic twice a day, that gets pretty complicated to teach somebody on a Friday night to be independent with. When we're only coming maybe a couple days in a row in the beginning and then like weekly for labs maybe, or maybe twice for wound care. So we would kind of get to know who those case managers were who would do that. So there were, a few cases where people just didn't really need us. And in order to qualify for reimbursement in home health, you have to meet multiple criteria. One is you have to be homebound, and another is you have to have a skilled need, which can be wound care, teaching, that sort of thing. And so there was one where when I was the director, we sent somebody out and the patient's on like a boom lift trimming his palm tree. Get out of here. Like we do the evaluation because there's an order for it, but then we don't admit. We let the doctor know this is how they presented. Here was their vitals. Here's the assessment data. Here's the meds they're on. This is, how we found him,
Yeah.
and so we just wouldn't admit, but it's not really happening too much anymore. Now we're getting really high acuity patients compared to what we are used
Where
to.
they should
Well, and there's
probably
a
be
So,
in
big
a
boom lift
facility.
shortage.
exactly. Yeah, I'm like, where did you get a boom lift, sir? You just got
Yeah, there's a
discharged
big
from the
shortage now.
hospital.
Yeah.
Like,
Logistically, it's just not happening.
yeah, exactly. Yeah, I thought that was pretty funny. I was like, sure, he's doing things he probably shouldn't be, but to each their own. Sir, you're good. You don't need
Yeah.
us.
Yeah. I mean, if you can operate a boom lift, you could probably change your own dressings, Just
Yeah,
saying. One
just
seems
saying. Yeah.
more difficult than the other at that point.
I'm thinking, yeah, I'm thinking for sure. I don't
What's your
even remember
favorite
what
part of
his
your job?
referral. Oh, that's a good question. There's so many things. I think seeing people improve over a long period of time, um, like healing wounds, really, like it feels like magic. And the more I learn about wounds, and able to implement that knowledge, just saying like visit after visit, week over week, like holy crap, this magic actually works. This is awesome. I remember one lady, she had this chronic wound for so long, and I came in for a couple months and just was really aggressive with her wound care, and it healed. And I was like, this is it. Like, you're good. I'll come maybe one more time and I'm going to discharge you. And she's like, no. And I'm like, I'm sorry. I'm not used to that response. And
Yeah.
she's like, if I'm on home health for another month, I get long-term disability. I quit. That's
Uh,
it. Like, I'm done. I'm so done. So, people's motives are always, kind of come into question. But I would say
uh,
healing wounds and just getting to know patients on a personal level that you probably wouldn't in other fields of
yeah,
nursing, like, in the hospital, you don't necessarily get to know them in the same way. And don't get me wrong, that can be a bad thing too. Some people you don't want to get to know. Um, but for
yeah,
a lot of the patients, they just kind of become like an extended part of your family and you.
man.
I mean, I've had patients that I've seen, probably the longest was on and off for 8 years. Like that's a
Oh,
long
wow.
time. Like
Yeah,
you really know somebody after that period of time,
yeah,
you know?
yeah. I'd say probably an ER nurse probably wouldn't have a reliable boom lift hookup either. I mean,
Probably not. Probably not. I mean, I should have been like, hey, let me come out there and like have some actually, hey, hey, hey. On one visit, actually, I go out to the visit, and the neighbor is having an air conditioning lifted onto their house. And the guy who was contracted to deliver and lift it up there was my friend. So I actually have a picture in my scrubs where he's letting me like navigate this. I guess you probably would also call it a boom lift. You know,
Yeah.
and you see the air conditioning like swinging, and he's like, whoa, 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 whoa. So that was kind of a fun experience for, a visit. And we just get to do crazy random things out here in these streets.
That's awesome. It is. Yeah, I think
Yeah.
honestly, as far as healthcare is concerned, I am way more a fan of. Normally, I'd say pre-hospital, but I guess you're kind of pre slash post hospital care.
Yeah. Yeah.
Um, but because one of the things we have to do for our education is we have to spend like 600 hours or something crazy in the ER, or not ER, but in a hospital, precepting. And that is by far the most dreaded part of the paramedic program.
I
But
believe it. I remember seeing them so bored.
yeah, but yeah, so I think we definitely have it better out on the streets. And you get those patients that are like, you're gonna do your best for them, but they are just annoying. They're a total jerk, whatever. It's like, I got to put up with you for this much time. I'm dropping you off, and you are someone
Light at the end of
else's
the
problem.
tunnel.
Yeah,
And I love that about home health too. If you go into a visit and, under certain circumstances, like you can literally leave in that
yeah,
moment. And I remember, not all directors are as I guess you could say as assertive as I was when I was a director, where, if they're saying things to you, a lot of nurses get like grabbed at or touched or things like this. You can be mid procedure. Like if you're mid Foley on somebody who has like retention and they can't go themselves and they say or do something and you feel unsafe, leave, put it
uh,
down and leave. Your safety comes before everybody else's. And
yeah,
then you don't ever have to go back again. And there have been
yeah,
times where I called the doctor and said, "We will not be returning." And I feel like in a hospital, they don't have necessarily that ability where if they have a kind of a jerk patient or somebody saying or doing those things, there's less ability to be like, you can't wheel them out the door and be like, "Bye, don't come back." Where we
yeah,
can kind of be selective in that way. So, um, yeah,
But
there's
then we get
definitely the
called.
ability.
yeah.
Yeah,
Normally,
exactly.
it turns into our issue, and then they're real riled up, and then depending on who shows up, they either take a ketamine nap or a droperidol nap or Versed nap or
Night,
uh
night.
yeah.
You said you're studying to become a nurse practitioner, right? Like you're completing that?
So I initially so when I was a director, I had finished my bachelor's while I was a director, and I always wanted to get my master's and be a nurse practitioner. And I was like, maybe I can do this while I'm being a director, but that is like a 24/7 job with phone calls and emails and just constant. And I was like, there's no way I can do this. So I'm like, okay, I'm gonna have to step down if I'm gonna go back for my master's. So I went back
Right.
into the field to start my master, uh, initially in an FNP program, family nurse practitioner. And maybe there's multiple routes you can take in a master's of nursing, right? There's like leadership, academia, a couple, maybe five or six different ones. And so the first four classes are generally the same. And as I was approaching the end of that fourth class, I'm like, I just felt so strongly to switch to a leadership track for a variety of different reasons. One was I'm going to have so much more responsibility and liability, and I'm already making the same money and even more as a director than all of my friends are as an FNP. And the malpractice insurance is higher. And you're kind of stepping away from the bedside in a way that it seemed a little bit less appealing to me. And I just felt the strong impression to move to a leadership track. And probably I think it was the last class I was in, there was some changes in our family where we ended up adopting two brand new babies, and
Okay.
I would have never been able to finish an FNP program. At that time, I would have been like mid clinicals. There would have been no way. So I
Yeah.
just wouldn't have finished at all. So I'm kind of debating if I want to go back for the DNP, the doctorate, um, or go back for something else, academia or a leadership track at a doctorate level. but the incentive is just really not there because especially in home health, there's few nurse fields where you can have the potential to make more money. Even if you're working in the hospital on a critical care unit, night differential, they're still not
Yeah.
making the same money as even potentially a new grad in home health under certain circumstances.
Yeah.
And so to move into an FNP role where, okay, they might be making, 120 to 150, which is great money, but for what they're doing and the responsibility they have, and just looking at the trends at how healthcare is going, they're kind of, especially in Las Vegas, there's a lot of conglomerates where um, right out of FNP school, they'll work for one of those companies where you're going to see 40 patients in a day and you get 3 minutes per patient and then you get 5 minutes to chart. And like that doesn't seem exciting or fun or really
Yeah.
impactful for me. So I'm kind of glad I went a different route. What's in the future for me? I have no idea. Like you said, I'm
Yeah.
waiting for my legit midlife crisis to decide what's next, I guess.
I mean, I think you should challenge your PHRN test and come out and deal with the craziness with us.
Maybe. I think actually I've challenged myself in the next month to go out on, a ride along here. And I
Yeah.
have reached out in the past to try to set that up and it just didn't work out. I wouldn't hear back from people and I was like, this shouldn't be so hard. Um,
Yeah.
because there's so many people from other places. They're like, oh yeah, come out here. Like you're good to go. Like here, I'll just email you the form. So I'm like, I just need to go on like this road trip to all these places
Yeah.
and do these ride-alongs. I think that would be
Around here,
so
it's super
fun.
easy. Like you can
Yeah.
just like show up someplace and like fill out one paper, and they'll be like, "Come on in."
I'm guessing you are so your EMS is not, if I remember correctly, is not fire based. It's a contracted private company. Is that correct?
So I don't entirely know what that means, but I'm going to answer the best of my ability.
Okay.
So usually when I'm calling 911,
Uh-huh.
I'll get fire department with
Hmm.
like an ambulance type truck, and they're
Okay.
usually at least one of them is a paramedic
Okay.
and like they know their stuff like really well. And then usually shortly thereafter, you get like your AMR,
Yeah.
your Medic West, community ambulance. I think
Okay.
there's one more here,
Yeah.
and they will always be the one to transport.
Yeah. So
And
you
from
have, they're all privately owned companies.
right,
And two of them are actually owned by the same parent company, which is funny. But those ones are a lot more difficult to do ride-alongs with because they have more of a corporate culture as opposed to a, I guess, kind of like, whereas the rest of like the either municipal or like nonprofit or fire-based, they're all kind of have more of an educational um
that makes sense.
thing going
I
on.
I,
Yeah.
I hear you. Okay.
You might have better luck with actually with the fire department riding out on they probably call it a rescue. Yeah.
Okay. Yeah, fire and rescue. Okay.
Yeah.
Yeah, maybe I'll try that route. I have a couple contacts here I could probably
Yeah.
reach out to and see about
For
doing
sure.
that. But I think they all work here primarily 12-hour shifts, I'm guessing, which has been so eye-opening to learn how different places do it.
Yeah.
Some people it's 24-hour shifts, on one day, off one day, on one,
I've done
Yeah.
various
40s
variety of
before.
schedules. Oh my goodness.
Yeah, that's how I felt.
And and then I know a guy who does like 3 days in a row and then a couple days off, and I'm like, oh my gosh, like I just can't even. I don't know. I honestly don't know how you guys do it, but thank goodness that there's people like you out here willing to do it for us.
I, usually we do get some downtime. It's not
Sure.
it's not pedal to the metal the whole time.
Yeah.
I always tell people that the all the shows like what was it, Night Watch, all of that, like for one episode it probably took them 10-12 hours of filming in several locations, like multiple cameras rolling to get that
Sure.
30
And
to
it
40
looks
minutes of
like
footage. Yeah.
from the viewer, that's like a day in the life. And y'all are
Yeah.
like, nah, not necessarily. Some days, I'm
Yeah.
sure, but other days, I've talked to other people where they're like, every now and then I get a day with like no calls. And from what I understand, like that is the worst. It just time drags and
So I think Aaron and I are split on that because
oh,
I love being busy. And that would be the worst for me, is not being busy. But that's kind of one of the things I like about what I do. I can kind of roam around jump onto calls. But I think Aaron would be perfectly content just sitting there doing his own thing all day.
Maybe it's
Well,
like the
not all
severity of
day.
ADHD you have, whether you like it or not. I don't know. I would go absolutely bonkers.
No,
And
I
that's
wouldn't like
one
that too.
reason, yeah,
He's
like
gaslighting me.
you'd
He's
think
taking the
in
opposite role
theory.
right now. Usually I gaslight him and he's gaslighting me right now, and I'm not happy about it.
Gotcha. Oh, yeah. You're used to being in that role. You're not
Yeah,
liking this role reversal.
yeah.
Exactly.
Andrew, we forgot to ask you, and
Oh,
I'm so sorry. It's like the most important
oh, you're
question we
good.
ask anybody. Do you prefer
Okay.
self-occluding or non-self-occluding IV catheters?
You should ask me what size butterfly I use when I draw blood because we are not
Oh,
starting IVs in home health almost ever. And usually it's like the cheapest trash that Medline offers is what we're starting an IV.
so
Rarely.
non-occluding.
Yes, that's usually, I don't even think, have I used a occluding, like self-occluding? I
Oh,
don't
they're
think I
so
ever
nice.
have in my life. Yeah. Like where you just make a mess. Like that's what we're used to. But yeah, most of our patients w that are on IV, right? They're coming home with either
Yeah.
a port or a pick or a midline. Or maybe like the end of some type of treatment where they'll have like a day or two on a
Okay.
peripheral and then we DC it.
Okay.
Rarely ever. Yeah.
Yeah.
The number of
All right.
people that have
Sorry.
asked me to use a butterfly to start like an IV on them, I'm like, I promise you don't. Like, you don't want me
Yeah.
to do that.
It's a different skill set for sure. 'Cause they would make you do that in the
Really?
hospital sometimes. Uh,
Really?
yeah, because we're used to being able to just slide it off. You can bend it, but you can't with that butterfly in there. You'll just blow your own IV for sure. I don't know.
Interesting.
I always
Yeah,
felt
I'm
like you had to be
just
real delicate with them. I don't know why.
I feel like it's so just, I don't know, so much easier. And we can use like I can whatever to get blood. Like I'm gonna do like a 21 or whatever, and they'll barely fill it, and I'll just go for the easy ones,
Yeah.
because I hope to not have to stick them twice. But most people are really good. I mean, there was one lady where they wanted me to draw blood on the day of the discharge, so I wasn't coming back. And I think I had stuck her twice, and I'm like, that's usually like all that I'll do. This isn't like, where I need to keep trying to save your life. Like they just want
Yeah.
CBC, or
Yeah.
whatever they wanted. And she's like, no, I don't want to go to Quest. Please, like, try whatever. And like, I got it on her foot, like, whatever. Okay.
Yeah.
Like, we'll do what we have to do. As long as, if you're okay with me sticking you over and over, okay, I'm fine with it.
I
Adrian,
mean,
what's the training like for your job? Because like for us, like we have to do a lot of time, a lot of classes and stuff like that. Obviously, you have to get your nursing degree, right? But I don't ever
Mhm.
see like multiple home health people working together. So like, do they like just have you do it a couple times with somebody else and say good luck?
So that is a funny question because there's two types of home health agencies, right? Um, and the training is one of the primary differences. Usually they all want to give a lot of training, but there's a lot of upfront cost to that. And usually by the point that they get authorization to hire somebody, they are already so inundated and just overloaded with work that the second that you could potentially go out and not end somebody, they want you out. And so I started as a new grad, and I remember like you have no expectation of what the training is supposed to be like, so you can't really be assertive to be like, this isn't the industry standard because you don't know. Now being in it 10 years, I advocate, people to get more training, but some of them will literally take you out once or twice and send you out, and that's it. The better ones will give you, like when I was a director, we had a pretty intense training, especially for new grads, which would be 2 to 3 weeks that you're doing first in office training, watching modules. Then we're doing, lab skills where, let's do trait care, let's do Foley insertion, let's do pick care, sterile procedures, things like that. Then you'll go out with somebody to do all those things. And particularly with wound care, like you can really mess somebody up. If you're doing a wound vac, there's things you got to look out for. If you're doing, a lot of people have lower extremity wounds and they don't know what they're doing as far as wound care. And like you could, you know, ha cause somebody to need an amputation if you're doing it wrong. And so um, we would have them go out, first observe, and then have them do it and have somebody, a trainer observe them. But I would say the average is like 2, 3 days. And
Wow.
at this point in my career, when I start, because I'm kind of like, I've found that the best way to do it for my circumstance is to be like PRN princess for multiple agencies. And because of my experience, usually when I'm starting with an agency, it's like, here's the paperwork. Which of these skills do you know how to do? Here's your patients. Bye.
Yeah. Right.
Um, Sometimes usually it's like it's kind of a small community, like people, and so it's like, oh, I've already worked with her at this place. I already know how she does it. So it's very different when somebody's been in home health versus when they're a new grad or they've never worked in home health. And
Yeah.
there's a high attrition rate too, not necessarily for not knowing how to do the job, but for the other aspects of home health that people don't like, such as people like the money. So they'll come from, working in med surg, which they hate, thinking, oh, I'm going to make so much more money, which they can, but they don't like working in people's homes, or they don't like working in an environment where you are by yourself. Like you don't have a
Yeah.
partner, you don't have a charge nurse, and I think that is overwhelming for a lot of nurses and driving. I would tell them in an interview, like, be prepared to drive like 100 miles a day. And everybody's like, oh, yeah, 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 we're cool. And then by like the second week, they're like, oh my gosh, there's so much driving. And I'm like, okay, well, let's look at like how much you're driving. Okay, this day was 25 miles, this day was 50 miles, this day was whatever. Like, I told you 100, like, okay, but whatever, I can't
Yeah.
be mad at you. Like, you said what you needed to say to get the job, but you didn't realize how much you wouldn't like that. So there,
Right.
there's some of the attrition is related to that versus, being able to know how to do the job. But we find that people who come from like an ED background, kind of like that, they're just used to handling the chaos, like tend to do better um, and stick with it more. There is the potential to uh, do really well, have it be rewarding, and make more money than in the hospital. And for a lot of nurses,
Right.
that's what they're looking for. They're looking to move up and have better standard of living.
Yeah.
Is there an ongoing like quality assurance program? Because like for EMS, we have like documentation we have to do where people go in and they, can apply flags to it where it's like, hey, we think you did the right thing. We think you didn't do the right thing. Why did you or did you not do this? And then like, regular trainings and stuff where someone's evaluating some of the more critical skills that we do. Ideally, that happens on a more regular basis than what it does. And since, your job is very similar where you're just kind of releasing people out there and saying, go do important things, don't mess it up with no supervision. Like how do you kind of wrangle that in?
Yes, there are multiple levels of that. So after training, in theory, and it's different based on the agency, what their policies and procedures are, but typically a nurse will have like a 1 month follow-up, a 6 month follow-up, a 1 year follow-up, where somebody at a management level is going out, filling out a paperwork that they observed, that they, followed aseptic technique or sterile technique, that they, interacted with the patient well, that they're kind of doing all the things right, that they're competent and able to do these things. Um, kind of on a review basis. And then there's also like a QA, which I think is sounds kind of similar from what I understand with what you guys do on a like a paperwork end where we're submitting a note, it goes to QA, QA's kind of looking over the note. And sometimes from a management level, we would see like, wait a minute, why did they do that? Or, okay, you just documented three of their vitals out of range, but like you didn't do anything about it. Like, let's maybe have a conversation about that. Um, and
Yeah.
so that would give you kind of eyes into training. But with the system being so inundated, a lot of these systems you can actually select what percentage of the notes go through QA by clinician. So, for example, this is a more experienced person, we're only going to QA 10% of theirs. Or this person's brand new, we're going to QA 100. Probably no home health agency is QAing 100% of their notes.
Yeah.
And then any agency that is accepts Medicare patients, they also have to have a QAPI program, which is a documented program to show a project that you're working on to improve, which usually they go for the low-hanging fruit, which is, a COPD program, a CHF program, infection control, where they're managing towards some type of metric, such as decreasing rehospitalization rates or something like that. So,
Yeah.
Yeah.
So do you have to show progress on those? Or is it just because there's like we have a lot of it may sound like a kind of jerk question, I get that, but like we
no.
have certain you can get certain like agency certifications that it's like, it's basically you pay, get inspected once, and then it's not real. Like everybody knows it's not real, except they go to these, municipalities like, look, we got this certification. Like, well, what does it mean? Like, nothing, but we have it. And it's a new sticker on the truck. And we have a different pin
Yes.
on our collar. And okay,
So
but
we're all just
what does
living
it
the same
do?
life then,
Nothing.
right? Yes, there are kind of accrediting agencies in home health that kind of do
Yeah.
the same thing where you pay and they come out and do kind of mock surveys where they're prepping you for the real survey here in Las Vegas. About every 3 years, you can expect for a state or federal surveyor to come in. And depending on what your census is, kind of depends on how long they're going to be there as well as what they find.
Yeah.
But they can come in at any time on a complaint survey. And those are
Okay.
always really interesting to me. And I always enjoy them, which most directors and, staff really kind of hate that part of the job. But I don't, for some reason, it makes me excited because I just love to show that I'm so good and I have everything
Yeah.
you need and more.
We have
Um,
a licensure, like each agency needs licensed every so many years where they come in, inspect all your trucks, inspect your station, check on this, check on that. I'm with you.
mhm.
I enjoy it. It's fun. It's like a
Yeah.
game, you know? Are you going to be able
Yeah,
to
for
trip
me,
me
like
up
I get
or?
to level up. Yeah, like what are
Yeah.
you gonna find? Like when, because I ran a tight ship as a director, so let me see what you could find. And then they would always pick, again, based on your census. So we would have around 400, which is pretty large, for a home health agency in the Las Vegas Valley. That's probably one of the largest. And so there's this, it's kind of like if you have 1 to 50, they'll go on one or two ride-alongs. If you've got 50 to 200, they'll go on four. And so when you got 400, they're like, oh my gosh, we're going to be here forever. And it also takes into account how many admissions you've done over the last year. So
Okay.
we would have survey for like a dang near a week when most agencies are used to it for like a day or two. And you'll have two surveyors come in. They just sit in your conference room and just dig through all your stuff, and they would say patients with like the gnarliest wounds, or who have, procedures, IV care, and we would set them up with a nurse, get the patient's permission for them to go out and basically kind of just observe what the nurse is doing, and then they might hang out after the nurse leaves to kind of ask some follow-up questions to the patient,
Yeah.
and then they would do a report, and then you might have some tags. Hopefully you would never have a condition, which is where you're breaching a condition of participation, based on Medicare standards, because that would like shut you down.
Is this
um
similar to JCO?
Yes, very
Okay.
similar. Yeah. Except like this is the government. Like this is either
Oh,
and they will come out. It's the kind of in Vegas it would be the same people showing up, but they'll either be doing a state survey or a federal survey, and the laws are different. So it's funny because if they're there on a state survey but they see you broke a federal, there's a federal regulation that maybe necessarily isn't in alignment, like they're there for a state, so like they would talk to you about it, but they wouldn't mark it. So there's kind of some funny stuff there, but fortunately, I worked for a really good agency that had very high standards and we always did well. But I'm sure, if I worked for an agency who didn't have their stuff in order, that'd be a whole different experience.
yeah. Well, and it's like we have they've recently in Pennsylvania, by recently, me in the last 10 years implemented, like they actually check the serial numbers on your cardiac monitors and things like that. Because
Oh,
there's a couple very well-known agencies that had literally two cardiac monitors and 20 ambulances. And while they checked this one, they were putting that in another one, and they just drove around the block and got all 20 through at the same two heart monitors and two suction units, two intubation kits. It's like, why are you licensing all these, turds on wheels that you don't have the equipment for? But I don't know. So now they check
yeah.
all that stuff because of certain agencies.
With that
Yeah,
dedication to
I
the
believe that.
operation, they probably could have just like generated some more money like through fundraising to just buy the cardiac.
Yeah. I mean, I think if they would spend the time opening up a lemonade stand with the amount of effort they put into rotating these trucks every couple of years, they might have been able to buy one or two more for sure.
Yeah, probably. It takes a lot of energy to backpedal and clean up a mess for sure.
Yeah. I mean, in our area,
Yeah.
they're a private company. So in our area, which is different than out where you're at, you have private, like for-profit ambulance services that run
Mhm.
emergencies and probably do a very good job. Where we're at, the vast majority of private for-profit ambulance services do nothing but interfacility trips, and
Oh.
their newest ambulance is like 20 years old, but the owner pulls up in, his Bentley. You know what I mean? Um, but yeah, and the employees get paid garbage, and it's like, well, you have no experience, so this is where you start. And they kind of, but
So
and they,
demoralizing.
oh, it is,
Hmm.
and they have a huge, huge, huge turnover. It's people last these places weeks. You know what I mean?
That's awful.
But yeah, but now we're in a shortage of providers, especially at the ALS level. So a lot of people aren't doing those stopovers. So hopefully that'll get the rest of them kind of a better wage and better equipment and things like that.
Yeah, like 3 years into EMS, I became a supervisor, which I was completely unqualified to do. Like
Yeah.
they still let me do it. I don't know why. Like they should not. Like
Yeah.
Still let
like
me do it.
somebody should actually stop it. It's bad. Like
Yeah.
That is
Well,
too
Aaron
funny.
doesn't know this, but he's actually on a hidden camera show. So
It's like, what was that movie with Jim
Ryan
Carrey?
Seacrest, where are you?
Yeah, exactly. Somebody's waiting out. You're being punked. Like at any
there he
moment,
is.
somebody's gonna
Yeah.
jump out. Yeah, that's pretty
But
funny.
right on. That's
Andrew, how'd you get into social media and stuff? Because I know that was the thing with like me and Fior, where like he was like, "Let's do this podcast." And I was like, "Oh, who wants to hear me talk?"
Actually, it's funny because so we had just gotten the twins, right? They are now 2.5. So this is like 2-ish years ago. And it was really to uh, kind of keep in contact and just put funny videos about the twins. And it's funny because it kind of took off to where we got like a bunch of brand deals to do promotion of kids' products and different strollers. And being in Vegas, there's conventions all the time. And so we went to like this ABC Kids convention and got like 4 or 5 brand deals just out of that one convention, and that was really fun. And it's funny because there was a point where I was like, yeah, now I know why people don't work with child actors. This is miserable. It's funny when they're like babies and you're just trying to, film them doing funny, cute things or playing with a toy or using some type of feeding product. But when they have mouths and they can walk and do things, I'm like, yeah, this ain't gonna work. So I'm like, well, it's kind of fun though, like just creating content. It's kind of a nice creative outlet. And so I'm like, well, I'm just going to make a post about nursing. I can't remember what it was. It was probably me complaining about something or other. And it actually did really well. And I was like, oh, like people care about that. So kind of got into, talking about just different, nursing stuff. And from there, one of those experiences was an experience where I had to call 911, which is where I like stumbled into EMS talk, which is like the most amazing community. And I have made so many amazing friends all over the country, just learning from them and just like soaking up their experiences and just getting to know people. And it's just been so amazing. I mean, people, I think especially on TikTok compared to other platforms, people are so supportive compared to the others. And it's funny because my first post, which was directed for people in EMS, and I was like, ooh, these people are like hardcore, like tough. It's like hard asses. Like I can't just be like, hi, I have a question. So I was kind of like, question, kind of like
you could have though, like the
my
only
approach was like so ready for people to like come at me, and it was kind of like, I had this call where I'm pretty neurotic where like I'm gonna have my T's crossed and my I's dotted. And so when I had this call and in the middle of my report, somebody's like, are they on any beta blockers? And I was so pissed that I didn't know immediately if they were on beta blockers. And so I was like, no, I need to know, like, what do you guys want and in what order? Do you guys do SBAR? Do you guys like care about their surgical history? Like, what do you want?
so
Kind of, and I was like,
here's the problem with
sorry, go
that
ahead.
though. We're all basically over caffeinated, ravenous raccoons. So yes
Scouring the
and
internet for
no.
the word 911. That's what we
Yeah.
do all day long.
No. But as far as like a report, it depends. Like if it's like a
Yeah.
routine thing, I don't care what order it's in, honestly.
Well, Fior, you have to start at the beginning of this. It first depends on whether you're a reasonable person or an
Yes,
unreasonable person. Because
true.
we have a
Hmm.
high percentage of people who do our job who are very unreasonable people.
Yeah.
So if you're an
Mm,
unreasonable person, then it doesn't matter what your report was. It could have
Yeah.
been their ideal,
Yeah.
report that
sure,
they could have asked for, and they will find something wrong.
Like you
sure.
could be holding their form in your hand and going down the list and you're still wrong.
Right.
But no, honestly, it's here's probably why you get a lot of like resistance, I think, in the field with what you do. 99% of the time when somebody presents on one of my scenes and says,
Hmm.
quote, I'm a nurse, they are not a nurse. They are in nursing school. Their aunt's, best friend is a nurse. They watched Grey's Anatomy. They're a CNA at a
They're an
nursing home.
MA or a
Yeah.
CNA or right.
And
It's
I'm
Yes.
like,
imposter syndrome, except the opposite way.
Oh yeah,
yes.
there needs to be a name for that. It was stolen valor or something. What are we calling
Yeah,
that? I
Yeah,
yeah,
don't
it's
that
like
know.
would be it.
the military has that one on lock, but that's the
Yes.
problem that we get. It's like, and then I know, so I would imagine that are they on any beta blockers? Was probably does this person know what she's talking about? I'm gonna act like because if you look at me blankly and you're like, what's a beta blocker? I'm like, cool, get away from this
I
person.
don't need another word
Yeah,
from you. Right,
exactly.
exactly. Yeah.
But
I think it also doesn't happen to us as much because most people don't know what the difference between an EMT and a paramedic is.
yeah,
So like
That's
so
true.
like
And hey,
they don't know what we do, so they don't even try to like figure out does this person they just assume that we don't.
yeah,
that's wild. And
yeah,
so, I didn't, the response I got was so overwhelmingly supportive of people. Like, first of all, they're like, first of all, you are there when we get there. And I'm like, what are you talking about? Like, of
They
course
yeah,
I'm
leave,
there.
that
Like,
happens. People
so,
just
just
leave.
learning, yeah, just learning about some of those, people's experiences with home health nurses was like beyond shocking to me.
yeah,
And so it just prompted so many more questions. So I had so many like other follow-up questions about experiences that I had, or just random questions that would pop into my head, and people were like so just happy and positive and supportive to like, hey, genuinely, I think overwhelmingly, EMS just wants to be seen and understood. They want like people just there's so little information about what you guys do. And I mean, myself even before that, I couldn't have told you what the levels are in EMS and like what the differences were and what they could
yeah.
do. And so people with no medical background probably know nothing. But for me,
There's a
I
lot of
kind of
people in EMS who also can't tell you that.
that's probably true. I mean, there's good and
Yeah.
bad in every, type of industry, but it just has been like a really good experience to have that level of support of people who I can go to like ask those questions because there's so much misunderstanding and just lack of knowledge of, what people do. But I've always kind of had kind of along the same lines of like that respect for military people, doing something hard for a greater purpose than themselves. I've always kind of had that same like revere and regard for EMS just growing up. And I think a lot of that is just that's
Probably
kind of
shouldn't. We're
how
nuts.
it's probably just kind of how I was raised. You're just respectful to people in any type of service industry.
Yeah,
And really, honestly, we're in service industries. And so,
yeah,
that was just kind of a part of how I was raised,
yeah,
to
I think
be.
we should get tipped like people in service industries, but
yeah. Like, yeah,
Hey,
you
they're
want
asking for
this?
tips now for everything. So you
I saw a
never
meme that was
know.
like you hold up the iPad after an emergency call where it's like
Yeah,
they're supposed to sign and it said like 15%. Rate
yeah.
my service.
Like,
Waiting to give you your pain med. What's your tip? Like,
that's right. So you've been really successful, I'd say, on TikTok, at least by metrics I can see. I mean, you have
thank
almost
you. I have a lot of
26,000
fun.
followers, and looks like you have a video with over 4 million views.
It's
How?
been fun.
Yeah, that's that. It's incredible. But yeah. So we're honored to be talking to you. Uh,
I'm honored that you guys would have me on the show. No, I really appreciate that.
but no, we definitely like your content. I think
Thank
I think one of the first videos that of yours that came across my page was there was some lady who made your entire profession look awful and was talking about flexing her nurse, and I was like, oh my god, I do not like this person already. And then it was like I was about to just scroll past it because I was like, I know this is gonna just piss me off. So I'm just gonna scroll right by, and then I was like, saw this like stitch. I'm like, all right, let me see what this is,
Hmm.
and then I was like, okay, so there are some nurses out there that have a grip on reality. Awesome.
Overwhelmingly, nurses did not support that energy from her whatsoever. Like, we don't claim that at all. And you know
Yeah,
what? I'm always the type of person where people make mistakes. People are just ignorant and don't know. And
yeah,
everybody deserves the opportunity to be educated if they will allow themselves to be and be better, right? Because
yeah.
I've learned so much, and now that I know better, I'm being better at what I'm doing. But so I'm like relentless about things to a point of like borderline harassment. And so I found out where she lived. I found out
Oh
her
my
phone number.
god.
I didn't show up. Okay, okay, relax. But I did text her and said, "Hey, let's do a live. Let's all learn together because we can all learn maybe where we went wrong and why this went that way, and let's have a conversation." Didn't hear back, but the more research I did on it, it just looked worse and worse, right? Like she was a is probably a nurse practitioner, owns her own business, is also a nursing student or instructor,
Yeah.
married to a doctor who works in a teaching hospital who is also a professor. So to be going on and like making somebody feel a certain type of way because they were a student
Hmm.
was just not, I mean, she clearly was not
Yeah.
thinking. And
No, it
so
I
it's
can
hard to come back from that, I think,
oh yeah.
unfortunately.
Well, and overwhelmingly from what I saw, everybody said the same thing, and I agree with it. You wouldn't have even been on my ambulance. I don't care who you think you are. You
Yeah.
know, I'll take this sick person, but I don't care what you do. You can drive yourself, you can call a cab, you're not getting in this truck.
I will say you did the
Yeah.
most wholesome version of private investigation that I've ever heard of.
Yeah.
You were like,
What's
let me
that?
track down this you let me track down this person so I can help build them up and give them an opportunity to talk about their like that's gotta be the only time that's ever happened. That's great. That speaks volumes to who you are as a person. Like you have great character. Nobody
Well,
else would be
thank
that
you.
nice.
Thank you. The power of evil in the right hands can be so good,
Yeah.
right?
Well, yeah. Don't share any of that information with a single paramedic because they will not do the right thing. They'll send her a picture of her house or something. It's like, well,
Oh no, like don't, yeah, we don't need to be driving by. No, I'm very much
I
like
was just trying to
respect
say it was
people's
nice.
privacy
yeah,
and like I'm not into like the doxing type of not
yeah,
at all. But I would want to reach out and give someone the opportunity to learn more, right? Because I think that in the same way you can have a huge impact negatively against something, when you know better, you can have an equally and opposite positive impact when you are then like, hey, I screwed up and I was stupid. And then I
yeah,
learned, and now, like, this is what actually is. And like, you become like an advocate in a sense. And
yeah,
I think that sometimes the biggest advocates kind of come from that background. They're like, oh my gosh, I was totally stupid and took advantage of this or said this thing. And then I learned. And now look at me, I'll fight you if you say something like that, you know?
yeah. Well, that's
So,
honestly, that's I think a message that everybody could use is like, ask questions and figure out where we differ. You know what I mean? You don't just because it's different doesn't mean one person's wrong. You know.
Unless
Uh,
Fior is trying to tell me something, which it's probably wrong, and he's gaslighting me, as
well,
demonstrated previously this episode.
except in that very specific instance.
yes, exactly.
Uh, but
Yeah, definitely
yeah,
asking questions. And I'm glad that part of me is happy that I was kind of naive to that like nurse v paramedic,
yeah,
energy that's kind of is out there. Because the paramedics at the hospital that I did my preceptorship, like the paramedics were the goat. And the nurses were so respectful to them, and I didn't observe anything like that that would make me think, coming in as a brand new nurse that there would be that type of energy. So I'm glad that it's not like the overwhelming experience
yeah,
everywhere, but listening to, some of these people, just a lot of my friends that I've made their stories, like it just gets me angry. And now the TikTok algorithm like feeds you what you're interested in. So now I'll be like getting ready in the morning and I'm like flipping through and there's like, oh, this nurse said that or that person said this and or that somebody's talking trash about how long it took the ambulance to get there or this person's
Yeah.
asleep at the wheel. Just random stuff and I'm just getting angry like, okay, put the phone down. We don't need to stitch everything. Calm down, Andrea, just breathe.
I'd like to
Yeah.
see the nurses and the
But
paramedics band together to fight the ultimate
yes.
evil, which is doctors who try to tell us what to do.
Um,
That's not cool,
That's
yeah.
bro.
right. Band together. That
We
is too
we
funny.
here at
Yes.
Thanks for the Consult
Unionize.
do not support fighting doctors.
Yeah.
We're gonna unionize against doctors.
What are
Exactly.
we unionizing exactly?
The people.
But
The people
like
together.
we're not a labor union. So like what?
Quit asking for details. I don't know. I didn't think it through.
We didn't know there'd be a test. We're not prepared
Yeah,
for
come
this.
on. See
It's
how that
your
works? That's
idea,
so
bro.
great. It's
It's
just
your
perfect.
idea.
Anytime you don't have an answer for something, you just bail out and you're like, I don't know. Like, why would you expect me to have the answers to these things?
Because
No,
it's your idea.
there's good clinicians across every, doctors, EMS, nursing, physical therapy, everybody in the hospital. There's good and bad. And I think
Yeah.
that the longer you're in the industry that you're in, the easier it is to recognize those people. And sometimes it's just out of lack of knowledge. They're ignorant, they don't know necessarily. And sometimes they're receptive to receive that knowledge and sometimes they're not. And all we can do is do our best to do our job around that situation,
Yeah.
I suppose.
I think the key thing that all of those really good clinicians have in common is they ask questions when they don't know the answer. Um,
Yes.
they're
Yes.
willing to be wrong and find out. Like I tell all my students,
Yeah.
you know, the difference between a good and a great paramedic is getting those follow ups. When that call didn't make sense, what was going on, get that follow up. If they had some condition you don't know about, research it, learn about it, and then the next time you see it, you're going to know what to do. And I think that holds true across every specialty because, like, there's no way for anybody to be a master of every specialty in medicine for sure.
True.
But
Definitely.
um,
Yeah.
yeah. Well,
When
hey,
in doubt, turn to Reddit.
no, no, God, no.
Dr. Google, if any, what's funny is when I was a brand new nurse, I was so like, if a patient in a visit was like, oh, what does this medication do? I'd be like, oh, crap. Let me search this. Well, I tell you. And now having done this 10 years, they're like, oh, what is this medication? If I don't know, I'll be like, I don't know. Let's go to Google and find out, or let's go
Yeah.
into the system. Like, it's nothing to be embarrassed about. You recognize that you don't necessarily have anything to prove, and you can not look stupid and do your job well and help the patient. They're not
Yeah.
judging you.
There's a couple
But
times it took me a really long time to call the hospital to give a report because I was doing a couple other things first.
Sure.
doing
Hey,
some
that's totally
research.
fair. Like you said, asking questions, that is a
Yeah.
key identifier of a good clinician.
What is
Yeah.
tachycardia?
Yeah. Break it down, Aaron. Break the words down. You got this. Remember our medical prefixes and suffixes.
TAC means strategy because of military.
Yep.
Cardia means credit card.
Yep.
Oh dear, we're in
Tactical
trouble
spending.
now.
You got it.
Oh,
Well,
that is too funny.
Andrea, it's been awesome having you on here.
Yes, thank
We
you. It
for
has.
sure will have to have you back on. Definitely after you get a chance to do a ride along. And I mean this with all
Certainly.
sincerity. If you make it out to Pennsylvania and you want to ride along, I will make it happen for you.
100%.
But before we get going, is there anything you want to say, get out there, any final thoughts, that you'd like to share with, us and the folks that listen to our show here?
Absolutely. Really just that I appreciate how supportive the community has been to somebody who asks a lot of stupid questions because I can get loud and curious and just ask all those stupid questions online and people have been super supportive and that has meant so much to me to be able to learn but also help me be an advocate for what you guys are doing. So thank you so much for that. That's my message. Appreciate it.
Well, thank you. Thank you for your support. Honestly, it does mean a lot. Having support of the nursing community, especially, the ones that we work alongside. So, you and home health, obviously our emergency department nurses and our facility nurses. That's
It'll
that,
make
Definitely.
this union transition go much more smoothly.
yeah. Um, But thank you for the consult today. It was
Thank
great.
you.
And Aaron, any final thoughts from you, buddy?
See you later.
Excellent. Uh, Thank you guys for hanging out with us. And if you're interested in joining us on here, reach out at thanks for the consult at gmail.com, and we'll see you guys next week.